Hello, everyone. We'll give folks a couple more minutes to hop on. I see some more folks trickling in. Just for everyone's awareness, we are going to be recording this session so that it's available online. If you have any concerns about that, please let me know. Additionally, we will be going through the entirety of the PowerPoint without questions and then have an opportunity for a question and answer session once the PowerPoint is completed. Okay, let's get started. Thank you all so much for joining us today for the Behavioral Health Facilities NOFA Technical Assistance session. My name is Christy Grover-Roybal. I'm the Deputy Director of the Office of Recovery and Resilience in Snohomish County. We are the ones that are putting this NOFA out along with our partners in the Human Services Department. Some housekeeping items. Please type your name and agency in the chat so that we can ensure that we have contact information and awareness of who's attending today. Additionally, this PowerPoint deck and the recording of this PowerPoint will be posted on the ORR, that's the Office of Recovery and Resilience, Housing and Behavioral Health webpage within 5 days. That link is available both in the NOFA and I can put that in the chat. As I said, the session is being recorded, and this recording, as well as responses to any questions, will also be posted on that website. Today, we'll be going through just some background information about the Office of Recovery and Resilience, timeline, the funding available in this NOFA, and specific highlights of this funding opportunity, and review eligible activities and eligible entities who can apply, and talk through the rating criteria. Then we'll go through specific pieces of the application, which includes reviewing the application checklist, making sure that you're all aware of each of the pieces necessary to complete and submit, or to submit a complete application, how to submit the application, the timeline and next steps for after submission, general tips, and then we'll have, as I said, the question and answer session. For the Q&A, you'll either be able to type your questions into the chat, or we'll be using the hand function in Zoom. So the Office of Recovery and Resilience started in summer of 2021 was started by Executive Summers to really help guide the $160 million of ARPA funding that was allocated to the county by the federal government. This funding is intended to support COVID-19 response efforts and kind of address the immediate economic stabilization issues caused by COVID-19. But then also, that resilience side is looking for long-term opportunities to address systemic and social and economic challenges in the county. The unique thing about this funding is it is one time, so we are really looking for projects that are only going to need a one-time cash infusion. Capital projects tend to fall within that. Additionally, there's a relatively short timeline. All funding must be contracted by the end of 2024 and fully expended by the end of 2026. And we'll review this a little bit later in the PowerPoint, but that is going to be a large factor in determining which projects we plan to fund with this. We do want to make sure that, all of the projects that we are awarding funding are reasonably sure that we're going to be done by 2026. We announced the NOFA at the end of November. We are hosting 2 workshops. The first workshop is today, December 19th. The second workshop will be January 6th, 2023. In terms of the content shared at that second workshop, it will be exactly the same as the content shared at this first workshop. There may be new questions, in which case we will be updating the Q&A. But there is no need to attend both the first and the second workshop. All of the information provided will be the same. Applications are due January 27th, 2023 at 4 p.m. During the first quarter of 2023, ORR and the Human Services Committee will review, and we plan to provide award notifications by the end of Q1 2023. So it's the end of March. Contract negotiations will begin shortly after that. What does the NOFA fund? So as I mentioned, these are for behavioral health facilities capital projects. The major requirement for this funding is that the projects must expand or establish new behavioral health capacity in Snohomish County. For priorities, we are providing additional priority points for projects that primarily serve individuals who are using Medicaid or are Medicaid eligible, and additional points for programs that primarily serve low and moderate income participants, which in our case, we're setting a threshold at families at or below 65% of area median income. And I will talk through how to evaluate that or to set that bar later. Obviously, programs that meet that first criteria, serving individuals who are using Medicaid, also meet that second criteria, so they get double priority points. Programs that are kind of above that, serving individuals and families who are above that Medicaid threshold and below that 65% AMI will only get one set of these priority points. And I will go through more of the scoring and awarding points later in the presentation. Some example projects could include building a completely new behavioral health facility. It could include just adding rooms to an existing facility or converting some rooms, enhancing them, that results in an increase in capacity of that facility, again, to serve additional people. Alternatively, it can be taking an existing building that is not a mental health care facility or a behavioral health facility, partnering with the owner of that building to convert that existing structure into a behavioral health facility. So we are very open in our interpretation of and our intent in terms of the capital facility side of this. We really are encouraging organizations to come to us with creative ideas of how they're using either existing infrastructure, their own infrastructure, or building new infrastructure to increase the capacity in the county. Awards will range from $500,000 to up to $4 million. It is an open and competitive funding process, and all sites must be located within the Snohomish County limits. We are setting a high kind of minimum because we recognize that there are a number of federal strings attached to this funding, and we want to make sure that these are of large and substantial projects that are going to be able to meet the federal requirements, which I will go over in a little bit. The applicant eligibility requirements that we've set are listed here, and I'll review them. All applicants must meet all of the following criteria in order to be eligible. If the organization does not meet these criteria, they cannot apply, and their application will not be reviewed. Applicants must either be a nonprofit, for-profit organization, local government, or a tribe. Applicants must obtain and maintain all the appropriate licensures and certifications for the proposed facility. Applicants must have previous experience in delivering the proposed service or similar service. We're not looking for organizations that are interested in starting new services that they don't have experience with, or funding new organizations who are starting work in this space for the first time. Nonprofit and for-profit business applicants must be licensed, report and pay revenue taxes for Washington State business license, and have any licenses required with the laws of the jurisdiction. All applicants must have a federal tax ID number or employer identification number. And again, all applicants must be able to spend the awarded funding by the end of 2026. So those were the requirements for each organization that applies. In terms of the project eligibility requirements, so what types of projects will we be considering for funding? Projects must be located in Snohomish County, and all funded projects must result in an increased capacity for behavioral health, care. We are using this broadly, and as you can see, the list included below is expansive but not exhaustive. We are looking to applicants to kind of explain to us what their measurable increase in capacity is going to result in and what that looks like for them. Furthermore, all projects must meet zoning requirements of the jurisdiction in which the project is located. All project activities must meet the definition of eligible activities, which I will define shortly. The projects must have site control, which means the authority to undertake the proposed project on the site. Recipients of funds for capital projects must pay state prevailing wages for all capital related activities. Project budgets should be aligned and not aligned yet not duplicative. If there are additional funding sources that are going to support this project, that is okay and would still be eligible, but we just need to see how the ARPA funding fits within your broader project budget. And finally, as I said, one of the federal requirements is that recipients must dedicate these improved facilities to behavioral health operations for 20 years after completion. We understand that that's a long timeline, but again, that's why we're focused on these larger grant opportunities, because we really want to build something that is going to be serving Snohomish County and Snohomish County residents for many years after the ARPA funding is gone. Eligible activities. So once you've identified that you're an eligible applicant, you have an eligible project. Within that project, we can pay for, or this grant can pay for, construction, renovation, or rehabilitation of facilities, any project soft costs, such as project management, design, permitting cost, purchase of equipment or furniture that is not permanently affixed to the property. Acquisition costs may be considered an eligible funding activity if the provider can demonstrate that they have fully secured enough funding to complete any rehabilitation work necessary to increase behavioral health capacity. So if you need this grant to purchase a building and then have additional funding to rehabilitate it into a proper facility, that would be eligible to apply. And if these projects serve multiple uses, so if you have behavioral health in a portion of the building and housing or daycare or some other, there are other ways that the building that you're constructing is planning to be used. Only activities and costs directly related to increasing the behavioral health capacity is eligible for funding. Ineligible activities, so we cannot fund deferred maintenance or repairs which do not directly contribute to making the project or property suitable for use as a behavioral health space, any fundraising costs, and any agency staff time. This is very much focused on the capital expenses. Okay. Now that we've gotten through eligibility, I'm going to talk through rating criteria. So I believe the total is 75 points. And we'll do some quick mental math to see if that's still correct. 10 of those points will be for organizational capacity. So that is looking at the history of project management, that the organization has previous experience and it has been able to demonstrate successfully implementing and managing federally funded projects in a timely manner and within budget, and adhering to funding requirements. Working with federal grants is a different and complex situation, and we want to ensure that the organizations that we're working with are up to the task. Additionally, financial management capacity. So reviewing or looking at to ensure that there are appropriate financial management controls as indicated by audited financial statements, and any audit findings previously have been resolved prior to the submission of this application. For 25 points, we are looking at readiness to proceed. So again, we are heavily prioritizing those projects which are either maybe already started and could expand, or are mostly ready to go, so that we can start building things quickly. Within readiness to proceed, we are looking at ability to meet pre-contract obligations. That's applicants demonstrate the ability to fulfill its pre-contract obligations in a timely manner, such as completing environmental requirements, addressing land use issues, addressing acquisition or relocation requirements, talking through other committed funding sources, things like that. The project timeline is weighted 10 points itself. So this project is shovel ready, and organizations are going to fully obligate funds, have them contracted by September of 2024, and complete the project and fully expend all of the award by December of 2026. For 5 points each, environmental and land use issues. So the organization has recognized and planned for any possible environmental and land use issues that could delay the project. This is kind of a larger undertaking for organizations, for projects that are breaking new ground, as opposed to projects that are enhancing or rehabilitating existing structures. Additionally, we are looking for opportunities to leverage and kind of support programs that are bringing funding from alternative sources. So additional funding, if the project has a budget that is clear, documented, and fully funded, so that the ARPA funding is enhancing or expanding kind of other funding resources and opportunities that are coming in to fully create the project. For 15 points, we have project soundness. So related project areas, if the organization includes complete and detailed descriptions of all geographically or functionally related parts of the project, the impact. So when completed, the project will directly contribute to a net increase in the behavioral health capacity provided by the organization at the new or improved facility, and looking at the budget to see if the estimates are reasonable and well supported and justified, and that the budget forms are consistent and accurate and thorough. For 30 points, we are looking at community needs and benefits, and that's in 2 pieces. So first is providing culturally relevant services, and that is if the applicant can clearly describe how they're identifying and challenging behavioral healthcare access disparities in the county through their work. We're really looking to partner with organizations who have incorporated racial equity into their work and can point to specific examples of existing policies and practices, and support demonstrates a commitment to racial equity, both in the organization and in terms of supporting the community. So finally, we have preference points for serving individuals most impacted by COVID-19. Each of these are 5 points. 5 points if the project is serving individuals who are using Medicaid or who may qualify for Medicaid. And then also that the project will primarily serve individuals at or below 65% AMI. And those are kind of two thresholds. As I said, if you meet the first one, you kind of automatically meet the second one because Medicaid eligibility is well below 65% AMI. So you would get 10 points if you only met, if you were kind of above the Medicaid threshold, but still below that 65% AMI, you would get 5 additional points. And then if you're serving primarily families and individuals above 65% AMI, you would get no points in this one section. So in terms of determining eligibility for funding priority points, we, as I said, are using Medicaid eligibility, and additionally, we're using 65% AMI. So that's this 4th column right here. So it's impacted families. So you can kind of determine the income of families you're serving and the size of the household and see if they're above or below that 65% AMI threshold. Moving forward to the application checklist, to have a complete application, applicants must complete the application questions, which we just reviewed, the project budget form, and then depending on the type of organization that you are, whether you're a for-profit, nonprofit, government, or tribe, there are a couple of different additional requirements that you need. Nonprofit organizations, governments, including tribes and municipal corporations, must have approval from their board or city council and demonstrate that approval either via a resolution or through minutes that demonstrate that the board is supportive of this application. And you can reach out, you'll need to submit that to us with your application. If you are going to be unable to get that approval prior to the application because of timing and, city council schedules can get packed quickly, you'll need to reach out to Robbie, who is a staff member. She's on this call and her email address is in the application, and you'll need to let her know prior to January 20th, which is a week before the application deadline, that you're working on approval, but you won't obtain it by the application deadline. Furthermore, nonprofit and for-profit organizations must complete the organizational document certification. This is attachment C in the application, and email all of those documents to us at ochs.mailbox@co.snohomish.wa.us. This includes for nonprofit organizations, the proof of the 501c3 status, for nonprofit organizations, current articles of incorporation and amendments, current bylaws as amended, and that's also nonprofits only. For-profits must provide their IRS notification letter of tax identification number, Washington State Secretary of State certification of ownership entity, and then all nonprofit and for-profit organizations must provide an organizational mission statement and length of time in existence, the current ownership structure, including board of directors or other governing body, a current organizational chart, current management team information, including resumes of executive director, owner, chief fiscal officer, and chief programming administrator, current year operating budget, the most recent 2 years of audits with management letters or financial statements, tax returns for the last 2 years, and the completed organizational document certification, which is in the application, just signing it saying that you've read it and have included all of the necessary documents. We do really want to make sure that we make it as clear as possible about the specific pieces that we need from each applicant. Additionally, applicants must be able to demonstrate evidence of site control. And then if applicable or available, letters of funding commitments, architectural drawings, construction specifications, a title report, appraisals, cost estimate, and a relocation plan if applicable. Finally, Organizations must provide either the copy of the state issued licenses that demonstrates qualification to provide behavioral health services, or a plan outlining key activities towards licensing the capital project, because we know that you can't get the license until you actually have the facility. So just let us know kind of the steps that you will take once the facility is complete. Additionally, there is the environmental supplemental application, and as I said, it looks different, or it can be a little bit more comprehensive if you were breaking ground and building a new structure rather than rehabilitating an existing structure, but each project is unique. But all applicants must include a completed environmental review supplemental application, and that is included in the application itself, a copy of the Thomas Guide or any similar map with the site location clearly marked, the county assessor property records, which you can access at that website, a copy of a current unanticipated discovery plan, and that's only if the project includes ground disturbance of any kind, a FEMA flood map with the site location marked, the Environmental Protection Agency map with the site location clearly marked, and you can access it on that website, Department of Ecology map with the site location marked, and map showing measurements from the site. Additionally, if the project requires a zoning change, you must have a signed zoning confirmation letter, a detailed history with property use, all available projects and site studies, photographs or aerial photos of existing site plans and drawings. And if the project contains new construction or rehabilitation, include the original total square footage of the site plus the square footage of the new impervious surface to be added. And if available, a phase 1 environmental site assessment for acquisition of land, new construction, or substantial rehabilitation. If that is not available, you can work with our OHCD staff to get guidance on that, and any hazardous material survey or assessment summary, if applicable. To submit your application, you'll need one original completed application with all attachments, a second hard copy of the completed application, and a complete electronic application on a USB drive. You'll need to submit those 3 physical documents to Snohomish County Human Services Department at 3000 Rockefeller Avenue. Additionally, you'll need to submit 1 electronic copy of the organizational document certificate form with all of those documents attached to the OCHS mailbox at co.snohomish.wa.us. Applicants must submit 1 copy of the NOFA application in person or by US mail, FedEx, or UPS. Applications must be received no later than 4 p.m. Friday, January 27th or earlier to demonstrate that the application was submitted by the NOFA deadline. After submissions, the Office of Housing and Community Development staff will complete the eligibility review. Similarly, at the same time, the Office of Recovery and Resilience Review receives copies of project materials, compliance and feasibility summaries, and threshold review and evaluation criteria for each project. ORR and the review committee will develop a prioritized list of funding recommendations and send that to Snohomish County Council for approval. The Snohomish County Council will then make the final funding awards. To submit a complete and successful application, we very much encourage you to follow the required format. You don't need to retype the questions or rating criteria in your narrative, just kind of speak to the questions and response. Be specific and answer all parts of the questions. And I strongly encourage you to look at the scoring criteria that we've provided as you're answering the question to make sure so you can see kind of what we are thinking of as a high quality and high scoring project. Double check your budget numbers and definitely have someone else review your application for you so that you can get a kind of external set of eyes and support. Start early and allow lots of time for the submission process. This is definitely not something we want people to be pulling together at the last minute, and ensure that you submit all required attachments and use that attachment one, the application submission checklist, which we've included in the application, to make sure that you're hitting all of the necessary documents. If you are looking for help, or if you have questions about the NOFA, you can email us at snohomishcountyrecovers@snoco.org. As I said, we'll have a Q&A opportunity after I'm completed with the PowerPoint. And all of these questions will be posted on the Office of Recovery and Resilience Housing and Behavioral Health page. Only written answers are considered official responses. We will be essentially taking whatever we share today and incorporating that into the written response in the FAQ. And with that, I will stop sharing and invite questions. Okay, I see that we've got some questions in the chat already. From Kristen at Volunteers of America, Western Washington. Do prevention services for children count as eligible programming? For example, mentoring programs. I will ask Cammie to respond to that.
Thanks, Chrissy. Cammie Hardy-Anderson, Division Manager, Behavioral Health Crisis Services and Veterans. Unfortunately, these dollars are for capital projects, providing licensed behavioral health services, predominantly treatment services. If you were to look at the examples under project eligibility, so no, children's mentoring prevention services wouldn't be included.
Thank you, Cammie. Another question from Kristen: are certain types of projects listed given priority beyond the population served at 65% below AMI or Medicaid? We are not prioritizing, we are not creating any prioritization within types of projects other than the population served. However, you know, we will be looking at all of the applications together to see what is the kind of set of projects received. Question from Jacob at Conquer Addiction. I can't see the full name, so apologies if that's not the full name of your organization. Is one agency allowed to apply for 2 projects? Absolutely. An agency can apply for multiple projects if they wish to. We, however, can't take multiple applications for the same project. So as long as there are sufficiently distinct projects that you're applying to, that's perfectly fine. And there is no limit to the number of of projects that agencies can apply for. From Barada, what is the total amount of funds to be awarded? This funding is coming from the mental and behavioral health funding bucket that was part of our ARPA funding. That bucket is a total of, I want to say $8 million. Is that correct, Cammie? It's $8 million. Some portion of that will be going to capital projects. We don't have kind of an upper threshold or a lower threshold other than that $8 million. We really wanted to see what was the range and need of projects in the community before kind of committing to any amount. So it will be up to $8 million, but not necessarily using the entirety of that funding set aside by Snohomish County Council. From Melissa: if you are partnering with another organization and you're providing the space, but will contract with another agency to provide the behavioral health component, should the agency applying get a copy of that partner's behavioral health license? Would letters of support from partners be helpful? Yes, absolutely. If you're working with any type of partner, please make sure that you provide some kind of demonstrated commitment from them in your application. We want to make sure that kind of all partners are aware of and in support of the application. And yes, you'll need to provide the copy of that partner's behavioral health license, one of the requirements, and it's listed in the NOFA application itself, but not in the PowerPoint, is that any kind of, if there are organizations that are applying together, a combination of them can meet those eligibility requirements. And in this case, it would be sufficient if you have that provider that is licensed. And from Jacob, can an agency get acquisition and rehab costs for the same project? Yes, they can. Again, we just need to, we're looking to see that all of the costs are expended by 2026 and that we can open up and that the facility has a plan to be opened and increase the behavioral health capacity in the county. From Melissa, if your timeline is to do expansion at more than one site and the first site will start in 2023, the second site will start in 2024, can you apply within the same application for both? I would suggest that you submit 2 separate applications. I think that is sufficiently 2 separate projects that we may that we would want to consider both of them. From Jacob, if acquiring and there is currently a business renting there, is it considered displacement if we wait until their lease expires? I will ask Robbie to answer that question.
Hi, thank you, Chrissy. That's Jacob, you're welcome to contact us on URA directly about that, because we'd probably need to ask a couple of questions such as how long until the lease expires? Is the business just renting there temporarily? Are they long-term renters? And is it really displacement if you give them notice? So that's, I mean, it looks like it's a simple question on the surface, but it really requires a little bit more conversation on that. And we'd welcome a call or an email from you on that.
Thank you so much, Robbie. And then also really want to echo that we are here to answer obviously questions today, but if you have questions in the future or ever unsure about anything, please reach out to us. We'd much rather have that conversation kind of before you submit the application. From Melissa, if one of the contractors is the only contractor in the state that provides one of the services you are using for expansion, do you still have to do the alternative bid process for that contractor? And I will pass that to Robbie.
Hi, I'm sorry, I'm having some issues with my unmute today. So if one of the contractors is the only contractor in the state and you are using, do you still have to? You can request to do a direct bid or a sole source bid on that, but you would need to request that in advance.
Question from Michelle. If funds are proposed to cover professional services for the project, it looks like federal procurement requirements must be followed, but what if the services have already been procured and are provided before the application was made? If those services have been already procured, actually, sorry, I'm going to have Robbie answer this to make sure that that's the right response.
Thank you. So if you're already paying federal prevailing wage for the services that have been procured for ARPA funding, the federal prevailing wages are not applicable. However, the state prevailing wages are. So whatever you use this funding for, you would be required to follow that procurement process, and the procurement process that you may have already completed, we would take a look at that to see if it met requirements. If not, you would have to go through some procurement process for this funding specifically and what this funding would pay for.
A question from Kaiser, can you tell us more about the timeline for decision-making concerned about choice limiting activities? Kaiser, maybe could you come off mute and talk a little bit more about what your specific concerns are?
I'm just trying to figure out what the timeline is for, after our application is in, where we, and the decision by county council, if this is 4 months, 6 months, what you're kind of looking at, because we would need to, want to keep the project going.
Absolutely. So in terms of the decision-making process, as I said, we anticipate that the final awards and decisions will be made by the end of March, in which case that would be when we are doing formal announcements. Obviously, there is some flexibility in that timeline. Things may get delayed or sped up, but kind of we are very aware of the tight timeline with this and are working as quickly as possible to kind of get those award letters out. In terms of choice limiting activities, and I want to make sure that I'm getting the right language. So we if your work is already underway, or if you plan to start work between now and when you anticipate responses going out, you may continue that work. OCHD will review environmental compliance documents to determine project eligibility. And at that point, if the project is found ineligible or not in compliance with environmental requirements, then Snohomish County would not fund the project. So if you are already underway, you don't necessarily need to stop everything. It's just that we will have to review the work that's been done to ensure that it meets the current eligibility and environmental compliance. From Jacob, the agency is 1 year old, but we have already managed one federal grant. However, we won't have our first tax return by the application deadline. Would we still be eligible by providing other financial statements? And I will pass that to Robbie.
Yes, whatever documents you may have that can confirm the financials for your agency is fine. And then we would collect the tax statements after.
Thank you. And then from Amy, if the project has already broken ground, could it qualify even though choice limiting activities have already taken place? Amy, I imagine that's going to be a situation where you'll want to reach out to the OCHD staff to talk through kind of what choice limiting activities have taken place and see if the project would still be eligible. But Robbie, if you wanted to add to that, please feel free.
Yes. So for choice limiting actions, the National Environmental Policy Act, the NEPA, it requires that prior to funding, authorizing, or implementing any actions, that we have to consider the effects on what that proposed action may have, not just on the environment, but on the related social and economic effects within the neighborhood of where that's all happening. So we get a lot of questions. This is one of the things that we spend the majority of our time on whenever OHCD does these presentations on our funding rounds. And if your project is already started and you have something other than ARPA funds in this, if you have any other state or local funds, you have probably already had to go through the environmental review process. And we would ask that you go ahead and complete everything. We don't want to discourage people from applying for this funding. We really want to encourage you to apply for this funding. So please complete the application with all of the requirements that we're requesting on the environmental, and then go ahead and provide a copy of either an environmental assessment or an environmental review that was completed by whatever funding source or whatever organization you had complete that. And we will take a look at that. What can happen if you're waiting for funding for us, and then you go through and say, okay, well, this is just an example. I requested $500,000 from Snohomish County, but we went ahead because we already broke ground and we were over budget on the funds we previously had, which is why we were requesting these. And then you paid out funds prior to having an approved environmental review. We would absolutely not reimburse you for those expenses. So that's something to keep in mind, because we do know that these are large projects. These are capital projects. Choice limiting actions that we're talking about would be, did you go out for procurement already? If you've already broken ground, you've already conducted procurement, you've already awarded contracts, you've already done all of that stuff. You've already signed contracts. And so those are the biggest things that we do have concerns about when we are the only funding source. But for larger projects that have already broken ground, you've probably already gone through those steps, even if you don't necessarily realize it, because all sources of funding, or at least almost all sources of state and local federal funding, require the environmental process to occur.
Thank you, Robbie. From Evie at Conquer Addiction, if I understood you, an agency would need to show they have site control at the time of application. If we are trying to purchase an existing building, would a signed option to purchase be adequate? I'll pass that to Robbie.
Yes. We run into that a lot, where the request for capital funds is for acquisition or rehab, and there's either the negotiation for a long-term lease, or there's a negotiation and a purchase and sale agreement already in place. And yes, that's adequate for us to show site control.
Thank you. From Travis, what is the desired level of licensed care desired by the counties for these funds? We operate recovery residences and we work with several nonprofits and outside partners for services, but do not provide any licensed services internally. I'll pass that to Cami.
Thanks, Chrissy. Yes, we are requiring that the agency is either currently licensed with the Department of Health, Washington State Department of Health, to provide a behavioral health service, or is licensed to provide a similar service that is going to be proposed in the new project. So if an agency is planning to request capital dollars so they can expand and then offer a site for another agency to provide some type of on-site treatment services, for example, you were going to partner with another licensed agency for them to come in and do licensed outpatient treatment, that could be considered, but it needs to be there needs to be a licensure just to assure the level of commitment and knowledge to successfully operate this facility for a number of years to come.
Thank you, Cami. That is the end of questions in the chat. Are there any questions, any additional questions that folks have? A question from Michelle. Would the federal procurement requirements apply only to the components of the development being funded? Robbie?
My first thought is yes, but it would depend on what the total project is, because we take a look at the total project cost and what this funding is going to be applicable to. For example, if this was applicable just to acquisition, it wouldn't be an issue. But if you are funding, let's say, a behavioral health center, and you want these funds to particularly fund a certain section, then it would be applicable to that. But if the budget is just all one budget and not specific to area or how you're being reimbursed for those funds by this funding, then it would apply to the whole project. So it really depends on how you're breaking that out and how you're tracking all of that. Thank you, Chrissy.
Thank you, Robbie. Any additional questions? Okay, thank you so much. Thank you all for joining us today. Very excited about this opportunity. And I'm eager to see kind of all of your applications. If you have any questions, please reach out to either myself and the ORR team or Robbie or Cami. We are here to help and support you. And as Robbie said, we really do want to encourage all of you to apply if you feel like you have projects that meet our requirements. And thank you. This will all be posted online along with the PowerPoint and the NOFA itself And we will make sure that all of you have access to the FAQs and any additional information as it comes up. All right, thank you, everyone, and have a great day.
Thank you, Chrissy.